Michelle and Bob.
Bob? If you're going to use a baby, say Bobby.
No, sorry. His name's Rob, but his family calls him Bobby, so I'm just being funny.
Good.
We're back. And I forget what we were going to talk about because I'm hungry. My brain's all messed up because I'm just a mental person at this point after all this. But no, because I was reading all these stories of women who got the same thing that I got done. And I realized while reading, because I'm on that group, that many of the women who get a TFMR done are kind of, some of them who have a gray diagnosis are kind of forced into getting a TFMR only because of time, because their state has a time regulation on it. And so, like, for example, I think the one I told you about was the one who had the brain anomalies. So she found out at 20 weeks, and she would have, if she didn't have the state regulation of a cutoff, she could have had time to do like the MRI and figure out, you know, if her baby would actually be able to live or not. But because of the state regulations, she couldn't. She had to make a decision fast.
Because what happens is this: it's all well and good to have an opinion on abortion and the abortion issue if you have not yet been in a situation that we have or a couple has when they're having a baby.
Yeah.
Because when you are having a baby and you go through the appointments, the doctor's appointments, you get the ultrasounds, they do the body scan. There's like people don't even know what those things are.
You did it before.
I didn't.
Yeah.
I mean, and I don't blame you, because if you don't know what those things are, the truth is you're not going to understand anything about what the laws should be.
Yeah.
So
just the fact alone that you don't have a body scan on a baby and an anatomy scan until 20 weeks, you know, there shouldn't be any laws and regulations that force women to have to flee and to have something done. Because I'm sorry, like, I just can't stand, I've heard this from a lot of people judgmentally, like, why don't you carry it to term? Or maybe something can change. Think about situations where the baby doesn't have a kidney, or doesn't have both kidneys, or doesn't have a skull. My OB said that. My OB, well, the nurse at my OB, she had to terminate at 12 weeks because her baby didn't have a skull. And that was when I was just getting my 12-week checkup and we didn't even know anything was wrong.
Mm-hmm. Yeah, so it happens. And the thing is, if let's say the baby's actually perfectly fine and then they're not quite sure what's wrong, what it could be, in the first trimester, if there's a law that says you cannot get an abortion past 15 weeks or whatever it is, it varies across the country. Then that's not enough time to actually determine whether or not you should terminate it, because in some cases you do need to terminate it, like if it doesn't have a skull, if it has triploidy, like what happened to us, or if there are other issues that mean that the baby is not compatible with life, so or the mother's health is at risk.
They don't take anything into consideration, and that's what upsets me, because you see all these people talking about this and I was doing research and I realized that when you look on Google, it talks about like, oh, most second-term abortions are because the mom finds out late she's pregnant, but that's not true at all. And there's a lot of women who are really suffering, and then there's not enough mental health care for women when they get TFMR, because they're getting treated more as like an abortion rather than a miscarriage, which I consider more like a miscarriage. So these women who go through this don't really have as much mental health care or guidance from the doctors, because they go into abortion clinics where it's not being treated. They're not giving you, like, here's connections for mental health or things like that. And a lot of people still struggle. I mean, if you just even go look on Reddit and look at the TFMR_support forum, you can see how many women are, like, struggling every day with anxiety. And this was talking to you about, which is making me so livid, is after this happened specifically, when we started looking into IVF, then seeing what was going on with Alabama, and again, politicians trying to control things or put label on things, and they make the whole reproductive health for women so much more stressful.
They should just give people this is a free country, right?
We're supposed to be able to do.
We're supposed to have the freedom to make choices that affect us directly, right?
Yeah.
In this case, what can affect a family or a woman more directly than pregnancy?
Exactly.
So she should be able to have the freedom to make the correct decision for her situation and not have bureaucrats determine those things.
Especially, I feel so bad for like the women undergoing IVF right now because it's so stressful, and then they're getting their procedures stopped only because of some lawmakers calling an embryo life, which is crazy to me. Like, it's
tell them about that story because I don't know. If
I don't listen. I didn't research the whole thing. I just know it was because of a clinic or whatever dropping. Someone walked in the hospital and broke two couples' embryos, which I get, that's devastating, but I just don't understand why they couldn't be given justice for that as like a financial loss or something. You know what I'm saying? Like if the couples were suing the IVF clinic for their embryos being destroyed, and I get that, and they should have had that redeemed as a loss, but to change it so that it affects thousands of women in a state is just not right, you know?
Yeah.
And I just, after going through all this, we were talking about how much procedures women go through that are very painful and how there's not even that's not there's so much stuff that you find out that's just not fair for women, like the Lamera sticks, like having to get dilated, that no pain management, and then realizing that I'd have to after this get like probably an HSG, and that's really painful.
So they put these laminaria sticks into the cervix in order to open it, dilate it, before they do a termination or for medical reasons, or an abortion. And sometimes an abortion too, right? Depending on how far along the fetus is.
I don't think for early term abortions they use it. I don't think they have to. I think because for dilation and I forget the DNC, I think it's more like a vacuum type thing. But when it's a second term, they have to open it up wider. Right.
So these sticks, they just put them in the uterus. I was there. I saw it with my own eyes. I was amazed that they didn't even give her any type of pain management.
I was right because I said to him, I was like, I'm so scared it's gonna be painful. They're like, no, they'll give you something. They're not gonna just do it. They didn't give me anything.
That's like if someone to like put the closest thing I can think of to that for a man would be to have when they put the tube into the head of your penis.
Oh, that's only a catheter.
A catheter. that's the closest thing, but that was extremely painful. I think I've never had it.
I don't know if catheters are that. I mean, I've never had a catheter, but I don't think it's that painful.
But in this case, this is a situation where you're dilating it like a whole opening that's this small. You're dilating it to be like this.
I would say it's more equal, like to kicking you in the balls, like by an elephant or something. Yeah. That's more cool.
So why would they not even give her laughing gas or
nothing?
I don't know, nothing. Like they didn't. You know, I understand. Okay, an anesthesiologist has to administer certain things, and maybe that would make the cost of this procedure higher, but they should have something, you know what I mean? They shouldn't just go in there and start messing around without any pain management. She's in excruciating pain.
Oh yeah, and I mean I don't want to scare people, but it's very painful. And that's the other thing is what I don't understand is like why can't they do an IV during the process? Just because there's a nurse there with pain management. They could, you know what I mean? Something, some sort of pain management or something. And then after you get this done, I have to go to an OB and get my uterus looked at and everything like that. But that's not even checking for scar tissue. What is it called? Hydroscopy?
It's called a hysteroscopy.
With that, I've read stories from women who say they weren't even put asleep for it. And I'm just like, how are you going to go in and operate on scar tissue on someone's uterus
right,
and not...
So what happens is the TFMR, or the medical termination, oftentimes leaves scar tissue inside the uterus.
Yeah, they have to remove.
So that in order for the woman to get pregnant, I'm not going to say 100% of the time because I don't know. But from what I hear, it's most of the time or it's common that it happens. Yeah. So they have to get this procedure called a hysteroscopy, where they go in there and they remove the scar tissue. So you would think that they would do that with some type of pain management, right? Obviously, if they're scraping inside your uterus.
Some cases I read that some were put under, but some were surprisingly not put under. But then again, if you look up the HSG where they pour... if you're going through fertility treatments where they pour like the ink into you, that women say that's more painful than labor. So I don't understand why they don't do that with like laughing gas or. And then I was doing research on it, and there's a doctor, you can look this up, who who came up with a new method of doing it where he uses like air or something, and it's supposedly not painful at all. And this is articles from 2016. Why haven't all doctors switched then from the HSG to doing the less painful one? Why are they still doing HSG? So
I'm a very skeptical person in the medical field to begin with. So
yeah, now with me having all this like natural bedded anxiety, we have to think of like a list of questions to ask the IVF doctors, and I'm kind of worried about trusting. I want to make sure I trust the person because we didn't feel good even with my OB.
Yeah, because we got the feeling like they were treating us like a number.
Yeah, it wasn't good at all.
There was very little, I don't know why that is, but the doctors that I've come in contact with as well, very rarely do they have a bedside manner.
Yeah. Unless you find one you can trust. Like my family doctor is such a good doctor. I've had him for so long that I trust him more than like my OBGYN.
Because he can communicate and relate to you like a human being.
Well, for example, with this whole procedure I just went through, I had an appointment already set up to go see him at a 6-month appointment, like a follow-up for a year. He didn't even know I was pregnant, anything like that. But I said to him I had a partial molar pregnancy, and he knew what that was because he used to be a labor and delivery doctor. And he said, that's extremely rare. And I said, yeah, I know, and I'm supposed to be measuring my HCG because it could turn cancerous. And I said, I bought a blood, like I paid for it at LabCorp to get it. He's like, why did you pay for it? Why didn't your OB? And I said, because when I called my OB, they told me that they couldn't do anything until I came in for my follow-up. He's like, yeah, but you should be monitoring it now. So he ordered me a test. But I'm just like, so I mean, like, if you have a good doctor, the doctor will worry about your actual health. But like this clinic or this OBGYN was just one doctor one day, one doctor another day, like very like closed offish. I didn't like them at all.
They didn't seem to
care.
Really care. Yeah, they didn't have much care in what they were saying. Like,
yeah.
They didn't try to make you feel okay with everything or try to get to know how things are. I don't know.
So I had like a very big trust issue with like the just like OB situation to doctors. So I'm hoping that when we go to the IVF clinic, we're going to RMA. I'm hoping that the doctor at RMA we like and that you like. Yeah. So we have to orchestrate like a whole list of questions, and maybe I should put what questions we're thinking of asking, but because I've already started researching, but I figure you need to have questions for you for like male health and like things that you want, and then I have to have questions, and then also you have to kind of make sure the doctor's a good fit, because I want to make sure that the doctor's compassionate enough to want to do stuff according to how we want to do it and isn't pushy with like their own
methods.
Yeah. Because we were just looking at the dangers of certain types of like, what was the woman talking about? This was a girl on YouTube I was just watching because I'm trying to learn about IVF, and she was talking about the dangers of, or why certain IVF pregnancies have more complications, like preeclampsia, and she was talking about like how with hers, she didn't have a natural cycle clearly because she didn't have the corpus luteum.
Yeah, because she was taking the hormones.
Well, you have to take the hormones.
She didn't do a natural cycle.
Yeah, like you have to take the hormones if you're not doing a natural cycle. And some people can't do a natural cycle. Some people have to do like a hormone medicated cycle. But she was explaining how when you don't have the corpus luteum, providing your body with progesterone, I didn't know this till today, but apparently she said also your body doesn't produce relaxin then. So I'm not a doctor.
And relaxin is what increases your hip size so that you can have a baby.
Yeah, so I was just wondering if women, again, this is not fact, it's just me wondering now because we're learning, but I'm wondering if for people who don't go through a natural cycle with IVF, does that mean that if they're doing the hormone cycle, that does their body never produce relaxin, and then do they automatically have to get like a C-section? I mean, I don't know. These are questions that I have that I want to ask a doctor, and I'm really hoping she's not one of those doctors who just like dismiss you, like, oh, you don't know anything.
Yeah. I hate that. I hate that.
That's
because
what I hate.
There's doctors who appreciate they have questions, and they'll go and they'll like care, and they'll go in depth, and they'll answer those questions to make you feel. And then there's doctors who they think anyone who like a patient knowing something and having questions is bad, and that type of doctor we don't want.
I was talking to this one woman who had that main problem with her doctor. Is the doctor actually? I didn't tell you this. The doctor yelled at her. Because she was asking a lot of questions because she wanted to know exactly what the protocol was going to be and like what this was going to do and what this was going to do. And he yelled at her and said, I'm the doctor, stop looking up things on the internet. But like that would upset me. Like I want a doctor who, when I go, I'm like, I want to know this is what I want. How can we make this happen? Or what direction can we go to make this happen more natural? Or I want to be able to express my concerns and not be dismissed like I'm an idiot and like I didn't, you know what I mean?
Yeah, exactly.
Because then it's like you lose control, and you have to have some control over something like this. That's just how I feel. That's why I think
Number one, you should never blindly trust anyone.
Yeah, you shouldn't.
Because there's a lot of horror stories out there too. I mean, like people just blindly trusting the doctor and then they botch surgery or whatever.
Yeah, but luckily, from looking at all these like IVF boards and stuff, like a lot of women, if they don't feel comfortable with their doctor, they switch their doctor like right away. So that's why our first consult, I want to make sure that we kind of have together. We know exactly what we want to talk about, or exactly what our goal is, and then afterwards we can ask each other like, how did you feel about this person? If I get a good vibe about the person, I'll be good. If I feel like she is very knowledgeable and smart, but cares about our concerns, that's
and is willing to answer our questions.
Yeah.
A lot of they're not even willing. A lot of doctors. I don't understand. I don't get it. But we also want to get a what do you call this? Besides the OBGYN, there's another thing.
Well, that's what you could do with the fertility doctor would do that. The saline ultrasound.
No. I forget the name of it.
What do you mean? For what?
Remember, we had an option like when we watched that documentary. Instead of going with the OBGYN. Are you talking about
midwives?
Midwives.
Oh yeah, but that's after. That's after you get cleared from like an IVF clinic.
Yeah, but I heard midwives are so much better.
No, I did. I heard that too. They care more.
Because they care and they answer these types of things. You know what I mean?
Yeah.
Answer these questions and then try to make sure we understand it. So.
Yeah, it's like a scary place. I feel like confused about a lot of things. You know what I think it is? I think it's that after you go through something like this and I don't feel like we had like a care team. I think if I had a doctor, like let's say it was my regular doctor. Let's say my regular doctor was my OB. And this whole pregnancy, he was my doctor and everything. I would have felt 100% more cared for because I would have known he actually cared. And he would have been like making sure I was getting like the right, medical care and decisions. We had like no one. And that's why going through this, when I already have like so much anxiety.
Yeah.
Because I still don't, like he knows, I don't know what's going on with my body still. And it feels out of whack and it's weird.
Well, it takes time to get back into normal.
We're very easily triggered by all this stuff going on with like the Alabama IVF stuff because I think it's because, how can I say this nicely? We are very strong Christians, but I feel like there's a lot of very judgmental Christians who make things more difficult for people.
Who don't really understand the real issues because they've never experienced it. So I don't blame them 100% because I was kind of like that. Not super judgmental,
you didn't understand it.
Just didn't understand all the ins and outs of what this pregnancy, getting pregnant and doing the doctor and all these things that could happen, complications that could happen, and how they affect the outcome of the pregnancy and circumstances where their termination is warranted and all this stuff. No one really talks about any of that.
That's why I'm so upset by it because I feel like if more people knew about it, more people would understand. And like I said, our church is such a great church that no one even questioned us, which is amazing.
They weren't judgmental.
No one questioned us. In fact, they said oh, I went through this too. Remember, and even
and it wasn't one of those weird churches. It's a solid church,
Yeah, and that's what I'm saying, but that's how it should be. You should have support. Like when you go tell your pastor, this baby's not going to live, you want that pastor to be supportive of you, not be saying oh, we'll carry it to term anyway. You know what I mean?
Yeah.
It's just
if she had done that, I worry that she could have had organ damage
because I was starting to get preeclampsia.
Starting to get preeclampsia. So if she were to carry that, I really think that it could have caused her health a lot of harm.
But I did have
some reason why
people who I won't mention. Other than who were telling me that I was being awful because it still had a heartbeat and stuff like that. That is annoying because it's they act like it's
Well, it was going to die no matter what.
It was going to die no matter what.
Triploidy is a condition that is incurable.
Yeah.
It results in death 100% of the time. The longest fetus or baby will live with triploidy is a couple of hours.
Yeah, it's not long at all. It doesn't live. It's very... And then when it came out, we realized it didn't even have had two right feet. But they were his feet because it had more of your DNA. It was two of his little... It was so cute. I keep it and I see your feet because it's literally a miniature foot.
It's kind of like my foot.
It's his foot. Exactly. Two of them. That was so cute.
Yeah.
It was. How do you do it? I picture it like I was carrying a clone of you with then my DNA on top of it. Or I just weird. But I just think if you know anybody who's going through this, number one, don't do that. Don't be judgmental. And be there for them. We have had like a lot of really sweet people in our life who have been like checking in.
Yeah.
But it also opened our minds. Yeah. And that's why we want to make sure that, I mean, I just feel like I wish I could go shout from the mountaintops.
Yeah.
And change these laws, because my heart breaks for the women dealing with this IVF. My heart breaks for the women who have to get medical care with no pain management. And my heart breaks for the women who get told their pregnancies aren't going to make it, and they get treated like it's an abortion, and they don't get treated like it's a miscarriage, because when you're going on your free will, of course, even if you're going to get an abortion on your free will, you should be able to have mental health care offered to you. But when you're going and you're losing a very much wanted pregnancy, and then you have to go through that route, there really should be like a mental health thing there for the women. There's nothing. Nada. Zero. Like, I'm still thinking, I told you, like, I might need to go get, like, counseling. I told my mom. Just because you have it's so much. And then you have permanent anxiety. Like, he knows I get anxiety. I get just random anxiety attacks because you just start thinking about everything. And I never had anxiety, ever. So, those are all of our rambling thoughts, and now we're going to go celebrate my brother's birthday, because I made him brownies.
Yeah.
So,
just checking in. Let us know your thoughts, what your experiences are.
And
we'd love to hear it.
If you had IVF, please put positive experiences in the comments. Because the problem with mine is I need to find people who have had positive experiences.
Well, there's a lot.
Well, my doctor's wife went through IVF the first time. She was fine.
But there's a lot of it's like you're acting like there's not many positive.
That's the thing. See, we always jump. We're always like, bye. We keep talking. But the one thing I was going to say is that a lot of people mention on like these group forums and stuff that you don't see good stories on there, because most people go on there when they have problems. Oh,
that's true. You're right. So it's skewed though.
It's kind of skewed a little bit. So you have to look for people who have like positive experiences. So, but anyway, we'll keep you posted one day at a time. This will be my last trip to this horrible OB. Never again this week. I'll be done. I'll be cleared. I'll be free. Never see them again in my life. And that's it. So, anyway, that's it. Bye.